Hi, hello, good evening to all the followers and viewers of Sakra page. And today we are here with our expert doctor, Manjunath Malige, Director Diabetes and Endocrinology, to discuss another important topic on diabetes and heart failure, which is very common today in right from young age to elderly people. Good evening, doctor.
Good
Welcome to our
evening.
live session.
Thank you.
And here we have got a few questions from our viewers on this particular topic. And we'll start off with the first question. What is the link between heart failure and diabetes?
Yeah, heart failure and diabetes are very closely linked in that way. The reason why vast majority of the patients in the world develop heart failure, one of the common reasons is diabetes. It's so common that at the time of diagnosis of diabetes, about 60 to 65% of the patients already have some element of heart failure going on, which can be detected on the echocardiogram or the echo scan. Even though it might be asymptomatic and the patient might not notice it, but the process of heart failure would have already started by the time the patient is given a diagnosis of type 2 diabetes. They are very closely linked. And most of the patients with the type 2 diabetes end up being at quite high risk of few major events in health. One of them being cardiac events like heart attack and heart failure, the other being stroke or brain attack, and the other one being kidney failure, amongst other things. So the association between diabetes and heart failure is very strong. And as we are going to discuss in the next few minutes, there is a very big role for the medications that we use for diabetes to play even in the management of heart failure apart from sugar management.
Okay, doctor. The next question would be, how much does diabetes increase the risk of heart disease?
Yeah, so there are various statistics from international healthcare studies there. There's one called Framingham Heart Study, which says that amongst men with type 2 diabetes, there, there is about a twofold increase in the development of heart disease, risk of developing heart disease, whereas in women, there is a threefold risk in developing heart disease. But these are, I think, a bit more conservative numbers, and realistically, the numbers can be quite high when we take into context our own sort of ethnicity, that South Asian lineage, we actually are at higher risk of developing heart disease due to diabetes because of our genetic predisposition and also our ethnicity. And most of our type 2 diabetes patients have good going heart disease, either in the form of heart attack or heart failure. And I would say the number could be anywhere between 50 to 60%. So that's a big number. And the reason why heart failure is so important is because heart failure management alone may not improve things, but the associated comorbid conditions like diabetes, high blood pressure, high cholesterol, obesity needs to be managed to have better outcomes of heart failure treatment. To put it in one word, once a diagnosis of heart failure has been made, nearly 50% of the patients may not survive at the end of 5 years. So that is the gravity of the situation. And hence it's very important that diabetes, which precipitates and could be the root cause of heart failure, has to be really managed well.
Yes, thank you, doctor. And why does diabetes make heart failure worse?
Yeah, so there are a few reasons why this could happen. I would keep it simple. One of the reasons why diabetes could worsen heart failure is it leads to a condition called atherosclerosis, which means deposition of cholesterol within the vessel walls, that's the blood vessels, which supply the blood to the heart. This is an ongoing process, and as the diabetes progresses, this cholesterol deposition in the blood vessels also increases, thereby narrowing the bloodstream to the heart, which can put the patient at risk of recurrent heart attacks, that's multiple heart attacks, which in turn leads to damage to the heart muscle and heart failure. That's one of the main reasons. There are various other reasons like insulin resistance and various other hormonal issues that can also affect the functioning of the heart in diabetes patients, which is why excuse me, we say that it's not just heart failure medications but also diabetes medications that need to be thought of when we have a patient who is at risk of heart failure or who has already developed heart failure.
Doctor, what is the best diet for heart failure patients?
Okay. When we talk about diet in diabetes and heart failure, the generic principles of dietary advice will remain the same. That's a healthy, balanced diet, which usually comprises of about 30% carbohydrate, about 30%, 30 to 40% of protein, and about 15% of fat, and the rest of the diet comprise vegetables and fruits. But having said that, when we have to talk about heart failure particularly, there is one particular ingredient that people have to be quite careful about and have to really restrict to the lowest possible dose, that is salt. And we call this as salt restricted diet. The reason why we say this is salt increases the fluid accumulation in the body, and whenever there is increased fluid accumulation in the body, that puts a bit of a strain on the heart, and hence heart failure worsens. So to answer in one sentence, it's salt restricted diet that our heart failure patients to adhere to, in addition to the balanced diet which diabetes patients have to adhere to.
Doctor, another question is like, what habits reduce heart failure risk?
Okay, there are many things. That's a very good question because, as we said, diabetes is one of the important risk factors for heart failure. There are other risk factors like high blood pressure, that's hypertension, high cholesterol levels, obesity, lack of physical exercise, and more importantly, stress levels. So, what this all means is that there needs to be an intrinsic and basic change in the lifestyle to reduce not just the risk of diabetes and heart failure but also various other complications of diabetes. This would include a healthy lifestyle which incorporates a healthy balanced diet like we just discussed a minute ago and a regular exercise program. The exercise program can be fine tuned to what you like. It could be just a simple walking for about 45 to 60 minutes a day. It could be jogging, bike riding, swimming, playing badminton. It's up to you. But then you got to have some physical activity going on to keep the insulin resistance low, which improves the diabetes control and also reduces the risk of heart disease due to diabetes.
Doctor, can diabetes cause heart defects?
Yes, it can. In that, diabetes, as I said, is one of the major risk factors for heart attacks, what we call as myocardial infarction. And once this happens, the patient is at increased risk of heart failure. In fact, one of the commonest cause of heart disease in the whole world is diabetes. And diabetes, as I initially explained, is so interlinked with the heart that we tend to say that diabetes by itself does not kill a patient. It kills by killing either their heart, causing heart failure, or by killing their kidneys by causing kidney failure. So that is how important diabetes control is, because it's not just controlling the sugars but also controlling or reducing the risk of heart disease and kidney disease due to poorly controlled diabetes.
Doctor, is it true that some new diabetic medications also help in improving heart failure?
That's right. That's a very good question. We are now lucky to have two groups of medications which have come out to the market just in the last decade or so, which are what we call as molecules of multimodality benefit, which means to say that they just don't reduce the blood sugar level, but they also significantly reduce the risk of having either a heart attack or heart failure or kidney failure in a diabetes patients. Now, one group of tablets are available, one group of medications are available in the form of tablets. They go by the names called dapagliflozin, empagliflozin, and canagliflozin. It's a once daily tablet. They have the advantage of reducing the blood sugar levels and keeping the diabetes under control. It also helps in reducing the weight, which is a welcome addition to the benefits, and it also reduces the risk of a diabetic patient having heart attack or heart failure and kidney failure. The additional benefit is that in diabetic patients who already have heart failure, these medications reduce the chances of admission to the hospital due to heart failure. We call it as HHF, which stands for hospitalization for heart failure. So these molecules particularly reduce the hospitalization for heart failure. They are so beneficial in heart failure, and That's to an extent that the international cardiological societies have licensed for these tablets to be used even in non-diabetic patients with heart failure. So this is not just a diabetes drug anymore, it is a diabetes and a heart drug or a cardiology drug. And my cardiology colleagues are quite sort of robust in using this particular tablet in their patients with heart failure, irrespective of whether the patient has diabetes or not.
Thank you, doctor.
And I just need to add, there is another medication which is luckily just once a week injection called dulaglutide. So I typically say to my patients, one injection every Sunday morning, that's it. And again, this injection is of particular benefit in reducing the risk of heart attack, heart failure, and also kidney disease. So a patient has the choice of taking a tablet every day or taking one injection once a week.
Thank you, doctor. And what are the symptoms of diabetes of heart disease?
So typically, the heart disease symptoms are fatigability or tiredness, exertional shortness of breath, that's feeling short of breath on exercise or on minimal exertion or even at rest. And the other symptoms are chest discomfort or discomfort in the left arm or in the neck, swelling of the legs, and coughing up phlegm. The one symptom that people may want to note is that this particular cough might occur at night, which will be associated with the shortness of breath, so that the patient has to wake up from the sleep, sit on the bed, get his breath back for, and after a few minutes has to go back to sleep. And this can happen again and again at night if the patient has heart failure. But more importantly, swelling of the legs, shortness of the breath, extreme fatigability are the ones that one needs to look for.
Thank you, doctor. Now, how does sugar affect the heart?
As I said, the basic sort of way the sugar affects the heart is by accelerating the deposition of cholesterol in the blood vessels that supply the blood to the heart. So it's basically like a pipe that's getting blocked in the plumbing section. So if the blood circulation to the heart is reduced, that leads to a heart attack. And a heart attack can always lead to heart failure, which is basically failure of the pump action of the heart muscle. The heart muscle cannot contract well and hence cannot pump blood into through the body, which is what is heart failure. Apart from this, it can also cause heart failure by causing damage to other organs, particularly kidneys. So if the kidneys are affected due to diabetes, which is poorly controlled, and the patient ends up having kidney failure, that leads to a bit of a fluid retention or excessive fluid within the body, which then puts a lot of strain on the heart, and this can lead to heart failure as well.
Thank you, doctor. I would request you to share your final thoughts on diabetes and heart failure.
Sure. So, the management and understanding of diabetes has changed significantly since the last 2 decades. It's very important to understand that diabetes management is not just about sugar control anymore. It's beyond sugar control. We are not looking at a tablet or an injection just to control the diabetes, but we are also looking at which medications to use that also reduce the risk of heart failure, heart attack, kidney failure, and various other complications of diabetes. So the next time when you see your endocrinologist, please ask them about your risk of developing heart disease in the background of your diabetes, and also ask about the medications which not only control the blood sugar level but also will protect the heart and the kidneys. This is something important to bear in mind.
Thank you so much, doctor. That was wonderful insights to all our viewers. And I would like to request our viewers for further consultation with our Dr. Manjunath Malige. You can log into sakraworldhospital.com and you can book an appointment over there, or you can just call us on the numbers displayed over there for the appointment. And I would request all the followers to follow us on all other our social media platforms, so we keep you updated on all the health related infos, so that you can keep fit yourself by following all the health tips which we share on regular basis. Thank you so much for joining us. Thank you.
Thank you. Thanks for watching.
Thank you.